Hello, and welcome to the Longev Lens. Please join my co-host, Dr. Sebastian Pedersen and I, as we cut through the noise and hype around longevity, health, and wellness, and turn the latest evidence into honest, practical insight for living better for longer.
And just a quick disclaimer before we dive in, this podcast is for educational purposes only and doesn't constitute medical advice. If you have a healthcare problem, please consult your doctor or qualified healthcare professional.
Welcome back to Rapid Fire number 2. This week we are going through stem cells. It actually came from one of our clients. They wanted to ask about some more of the regenerative medicine protocols that seem to be getting hyped and trended around the world right now. In particular, stem cells is one that we're going to be talking about today, and mesenchymal stem cells. As part of our rapid fire segment, it's going to be a quick 10, 12, maybe 15 minutes at the very most, but we want to try to get these questions out with actionable detail. And from there, Dr. Seb joining me again today. What are stem cells?
Thank you, Corey. I think the way to think about stem cells is they're very much the master repair cells of your body. So they help heal or repair damaged tissue, but as you said, they also rejuvenate aging cells. And there's a couple of different types of stem cells, but particularly for this client who's dealing with musculoskeletal issues or arthritis, the main one we're focusing on is the MSCs, or the mesenchymal stem cells. And the reason why they're important is that they can help form bone, cartilage, muscle, tendon, which is what we want in the case of arthritis. They are found or harvested from fat or from bone marrow, and the main one either being liposuction. You can harvest it from liposuction, or you can do a bone harvest from usually the pelvic bone, so the iliac crest. What you then do is you then go through a processing phase where you want to extract the stem cells, and then you re-inject them into the target of interest. And there's most evidence for knees, then there's shoulders, hips, backs as well, in that order of decreasing levels of evidence.
Yeah, I saw some pretty good evidence on like the knees in particular more recently. Like some of the outcome measures that they were using, like the WOMAC, the Western Ontario McMaster University. So like the self-reported outcome measures from people saying over a 6 to 12 month period. That was about as far as I saw when I was looking at the research, that there was, only 12-month follow-ups. Do you think that's actually long enough?
Yeah, I found another one where, so the stem cells that you use are, it's your own stem cells, obviously, for one, but it's usually about if you have a positive benefit, and it's not guaranteed you will respond positively to a stem cell treatment or a course of stem cell treatments, but it's about a 10 to 45% range of improvement in pain and function. Yeah. And that usually kicks in at about the 3-month mark and can actually last 12 months or a couple of years in some cases.
Okay.
So it's very variable, and you can have it multiple times.
How often would you have it?
It depends on the person, but you can do it every 3, 6, 12 months, depending on their response, obviously. But it also depends on, for me, if I have a client who's interested in this field, especially if they're doing multiple stem cell injections, the cryopreservation is key. So which means they only get one harvest, because the actual harvesting itself, you have to take a bit of bone out, or you have to do liposuction, so that's a procedure. So you want to make sure that the person who you're doing it through is storing it properly, so that you can still use the same sample for the subsequent injections.
Okay. So how does it actually work?
So it's got anti-inflammatory properties, and then where there's not as good evidence yet is, does it actually regenerate the cartilage? Does it actually regenerate the bone? That's mechanistically what they're trying to do, but it's still such a variable field. I mean, the big one for me as I went into the literature was the person's actual health status is a major indicator of how successful the stem cell is going to be. So if you have a healthy person, and also if they're young, if the condition they're treating is relatively mild, they're more likely to have a better outcome. Where if someone's relatively unhealthy, they're older, and it's a severe condition they're trying to treat, it's more likely to be less favourable.
Yeah, I'd imagine someone who just purely has obesity, that metabolically they're unhealthy, so there's possibly a lot more inflammatory markers throughout their entire body, which is going to exacerbate arthritis more. It's not just like the wear and tear that we sort of used to think, or there was an injury, it's purely just because of that. I'd imagine even just There's also well known in the literature, when you are obese, you are putting a lot more pressure into those joints. So there is a physical, mechanical perspective of it, but there's also a metabolic active component to it as well. Now that we've considered whether someone is healthy or they're obese, what would be some other considerations or risks that might be involved with actually taking stem cells?
Yeah, the theoretical evidence is still cancer, like they can form tumours. But the way the stem cells are used for musculoskeletal conditions or arthritis is almost negligible, that risk. The evidence that shows that these stem cells can form tumours are when they're cultured and repeatedly dividing cells in a lab. So that's not usually a major consideration in this cohort of people. And there's obviously the risks of the procedure where you harvest the stem cells and the risk of injection, so infection. And then also there's a potential downside of you maybe paying money and hoping and it doesn't actually provide you any benefit. So that's, I think, the big risk to be aware of. I guess another question is who should consider stem cells? Might be another question that I always find very, very important. For me, it's if they have a musculoskeletal condition, they're doing the physical therapy, they're doing the rehab, they're doing everything else they can. You mentioned obesity, especially for joints, they're making sure that their weight has been optimized. It could be one of the tools in the toolkit, so part of a treatment plan for someone who's relatively young, they don't want to have surgery, they don't want to be on narcotics. So it could be something we'd consider in this case. But again, it's something that you need to have a discussion with that individual, so the pros and cons of doing it, and ultimately what are we trying to achieve? And maybe being outcome focused is very important.
You mentioned you can actually harvest it by liposuction before. Is that, from what I've heard in other procedures, if there is large amounts of fat taken from the body, that can actually be fatal?
It's only, compared to someone who's having a liposuction treatment for obesity, this is a relatively minor thing. They're just extracting some fat cells, not a huge amount, not litres or kilos of fat.
Yeah. Okay. All right. Actually, I sent you someone yesterday as well. They're a notable surfer in the world. I don't know the full history. We don't have anything like that, a medical history or background, but they had stem cells injected into their spine 2 years ago. And then they sort of needed another checkup today. We were sort of talking about the fact that, they'd reduced pain, but what they were showing online, again, just at a surface level, was that, there was a reduction in the disc, like in the spine.
Yeah, the prolapse of the disc.
Yeah, exactly. That actually led to maybe there was not as much encroaching on the spinal cord, which was maybe leading to pain. What was your thoughts about that, considering that you're kind of basing that off just the MRI?
Yeah, that's fucking. So as soon as you start treating purely based on an image or a blood test, it's a slippery slope, because then you're targeting multiple things that may not be causing a problem. So for any of these experimental treatments that aren't necessarily typical, it's very important to sit down and actually have goal setting at the start. And what we're trying to do is improve your symptoms and function, not trying to treat a scan or a blood test. Which I think is the other, as you said, is with that surfer, obviously he was promoting it through his platforms, but this is a field that is experimental, and you really have to do your homework about where you're getting it done, how are they doing the harvesting, how are they doing the preservation, the cryopreservation, how are they doing the processing, and then also they're doing it for your benefit rather than just trying to sell products. Because if you go to a provider where this is the only treatment option they have, there may be some biases involved about whether they offer you or recommend this treatment. So that's where a lot of homework has to get done before you commit down this path.
Yeah. Is there such mixed results?
Super variable.
Whether it's PRP, stem cells, as you say, because of, it may just come down to how they've actually harvested, as to whether the research shows, this method worked a little bit better than this one, which... Again, would you think that right now we don't have any black and white clear answers as to
correct,
this works, this doesn't, this dose?
And I just don't think we'll get that. It's every single person is an N of one. You can't have a randomized control trial or a massive trial.
N of one, you mean that it's very individual?
It's exactly right. You're using your own stem cells. So if you have stem cell treatment, you can't compare your results to my treatment because we have different stem cells.
Yeah.
So how do you make a compilation of everyone when there's variables in terms of disease severity, health status, and if you do those, you do confound for those factors, these people need to be investigated to the ninth degree just to make sure that all these potential metabolic influences and all other impacts are considered.
Is there a thing such as people using other people's stem cells, like an older person using a younger person's stem cells? Or again, is that increasing like a massive infection risk?
At this point in time, it's mostly your own stem cells you want to be using.
Okay.
Yeah.
Yeah. Okay. Awesome. That's perfect. So if someone was to consider going down this pathway, if we were to wrap this up for our rapid fire number 2, what would you think of the considerations that people need to take in as just a quick little summary?
Yeah, I think the first one is do your homework in terms of where you're going to go, where you're going to get information from. Perhaps get a second opinion from someone who's external, just to make sure that you fit the criteria you have the right indication for it, you've got the right health status to actually benefit from this treatment, and also that it's an outcome-focused service to make sure that you have a goal that's set at the start. If it's knee pain, we're trying to improve your knee pain, or we're trying to allow you to go on a travel overseas with your grandchildren or your children. So that's for me the big key factors to consider.
Awesome. Perfect. Thank you, Dr. Seb. That's rapid fire number 2. And then next episode will actually be one of our larger ones. We're going to be going into depth with heart disease, which for some people it might be like, oh, what is that? Or other people might think, oh, this is a bit of a boring topic, but it's actually still by far the number 1 global killer. So we wanted to try to really knuckle down into what actually influences it and how we can change it. Thank you for having us on board.